got his arm caught in the cogs, re-greasing an agitator as it was running.
Please, don't hurt. Hang on.
You're doing really well. We're going to help you out.
Hands that are crushed and torn in machinery can be really, really painful injuries.
Are you happy for our ketamine?
Yeah, just 30 milligrams an hour looks good. Hopefully he's got an elbow still. Get some x-rays of this thing and see what's actually there.
This is almost certainly going to be a life-changing injury.
You were by my side, came to my aid. Look inside my eyes and help me try to ease the pain. You're my lifeline, tell me it's gonna be right. You're my lifeline, reach out your hand, take mine.
Very worried for you, my friend.
The bone's been smashed to bits.
Whoa!
He's actually stopped breathing.
Clear.
Without intervention, he's likely to die.
That's better.
I need you to save me now.
For Royal Melbourne's Director of Emergency, Dr. Mark Putland,
You guys have ordered the scan? Very good, all right.
and Nurse Unit Manager Susan Harding,
How was the night?
Very busy.
it's a huge job juggling the constant demands of an emergency department that never stops.
My name's Mark Putland. I'm one of the doctors. How are you?
The director of ED at Royal Melbourne's a busy job.
Has he had an aspirin at all?
Did he have aspirin? Just saying. Yeah.
I have to make time to work shifts on the floor. I need to know how it is down there, and that means actually doing the work.
This is a very challenging morning.
And today, the ED is as challenging as ever.
Hormone receiving, go ahead. So it's a 36-year-old coming by at M5, cleaning a machine. He's basically been degloved from his elbow down. Got a tourniquet above the elbow.
G'day, Mark Putland speaking.
Dr. Mark is onto the crew of an air ambulance that's bringing in the severely injured man from country Victoria.
Yeah, no, give him a dose of that. That's sensible. Yeah, that'll be fine. Okay, so just gonna give him a gram or something, eh? Or
They've described a young man with his hand caught in a machine degloving, which means that a tearing off of the tissues away from the skeleton. A tourniquet has been applied, which means they've put on a tight band to restrict blood flow into the limb. It's a life-saving manoeuvre, but it indicates a serious injury.
what time are we expecting the HEMS?
Call through any minute.
I might go and get sorted out for that then.
Dr. Mark and his team ready the trauma bay for all possible scenarios.
You got the med pack if you need it.
Brilliant.
The chopper's carrying 36-year-old Luke, who was working in a limestone quarry when the accident happened. Luke was greasing the cogs of a machine that crushes rock when his right arm got caught and pulled into it.
You're at hospital now, Royal Melbourne. Best place to be.
The young father had only been working at the quarry for 2.5 months.
Oh.
Yeah, they're here.
They're on the roof.
They've landed.
Hopefully the ketamine infusion is managing his pain.
Human hands and powerful machinery are a very bad combination, and hands that are crushed and torn in machinery can be really, really painful injuries. Ketamine's a really powerful anaesthetic and pain-relieving drug. It can make you a little bit spaced out and a little bit disconnected from the world, which can be beneficial when you've got a great deal of pain.
Do job.
Yeah, that's just the medicine makes you feel a bit wobbly.
Don't hurt. Please, don't hurt.
Emergency Dr. Luke De La Rue immediately scans for other injuries, which could add another complication to an already terrible situation.
All right, Paul, fire away.
So 36-year-old Luke was re-greasing an agitator as it was running.
Try and keep your legs down.
He got his arm caught in the cogs and it mixed it up to his elbow. He's walked 20 metres to call for help. The crew describe it as a ball of string yen. They couldn't identify a hand, they couldn't identify a bone.
Luke has managed to extract his arm from the machine and walk 20 metres to get help. This is the sort of thing we see in people with really horrific injuries who just have no choice but to do something to save themselves. You get a surge of adrenaline. It's a life-saving response.
Luke lives 3 hours away from the Royal Melbourne. His brother Joel is rushing in to be by his side.
you happy for our ketamine?
Yeah, just so 30 milligrams an hour looks good, and we'll see how it goes.
Yep.
With such an extreme injury, Luke needs a huge amount of medication to control his pain.
Promise ever.
Don't know if the airway's patent. Other than the arms and the limbs are okay.
Does look very isolated.
You're okay. I'll try not to move that, okay?
Luckily for Luke, he doesn't have any other serious injuries, and the team can focus on his arm.
We'll get some x-rays of this thing and see what's actually there. And if it's possible to get something of the end of his upper limb to see where this stump is.
We want to get some x-rays to see where he's got good bone, where broken but usable bone might be, and where there might be complete loss of bone. I'm not very optimistic for Luke's arm. This is almost certainly going to be a life-changing injury.
Yeah, and we'll see what it looks like. Yeah, just want to see what we've got. It's an amputation.
Emergency Registrar Dr. Asia Hullard has called Melbourne home for the last 7 years and has no plans to leave.
I just love the culture here. I love the beach life. I love the work-life balance, and I've made some great friendships here, and now I'm engaged. So yeah, it's firmly my second home. He's Australian. I met him coming up to 3 years ago now. He proposed on the St Kilda foreshore, which is kind of a special place for us. It's where we had our first date. I'm not sure when we're going to have our wedding. Next year, I've got a big exam coming up, and that's where my focus is.
With Dr. Asia's tea break over, her next patient is arriving at the Resus Bay.
It's probably going to hurt a little bit when you're not across.
It's chill, man.
Are you sure?
Just go for it.
27-year-old Reg was running across a busy road to catch a tram when he was struck by a car.
Ready, set, go.
Bit of a ride, eh?
Are you right?
My name's Asia Hullard. I'm one of the doctors. I'll be part of the team looking after
Sorry,
you.
what was your name?
Asia.
Asia, nice to meet you. Asia.
Nice to meet you. What's your name?
I'm Reg.
The community worker was rushing to get to a date when the accident happened.
We're looking at Reg's ankle. It's obviously quite deformed. He was hit by a car, so he is at risk of being head injured, chest injured, pelvic injuries, his spine. What would you like for me to do? Yeah.
Making sure Dr. Asia has the support she needs is experienced emergency doctor Ali Al-Jabouri.
So this is Reg. Reg has stepped in front of the car. The car's collided to Reg's right-hand side of his body.
I'm going to cut off your trousers so we can have a look at the whole leg.
We're a little bit unsure of then how Reg has fallen onto the ground. However, looking at the car, there's like a star pattern on the windshield.
This side's fine, but you've got some pain here.
Yeah, a little bit.
His right ankle, as you can see, is severely deformed. Some queries, protrusion of the bone at the anterior side of his ankle.
Ali, from a primary point of view, airways patent, chest is nice and clear, good air entry, a little bit of lower rib pain. In terms of long bones, it's just the obvious injury that we can see.
The injury to Reg's ankle is so severe that the bone is sticking through the skin.
I think there's quite a bit of swelling. Looking at Reg's ankle, my main concerns are that he has a fracture. I'm concerned that he may also have a dislocation. What we'll need to do is a reduction, where we pull the bones back into place. So this is really a serious injury.
But scoring your pain, 0 to 10. 0 being no pain, 10 being eaten alive.
There is maybe a 7, an 8 in my ankle.
Emergency nurse Gunnar Pettersson knows it's important to encourage young men like Reg not to hide their pain.
Young men tend to downplay their pain, often because they want to seem tough. This is not the place to try to be tough. This is a time and place to be honest. This is the time and place to tell me exactly what's happening.
A little bit, but it'd be nice to make it a bit comfortable.
Oh, absolutely. We'll make it much more comfortable, man.
That's a great tool.
Yes, and we'll just do a sheet through of the ankle, please.
The X-ray confirms their worst fears.
Okay.
What we can see is that not only has he got fractures, but he's dislocated his ankle. It's really important that we reduce the fracture as well as the dislocation. It's important that we do it urgently because with an open wound, the main risk is that of infection.
So, mate, what we're going to do now, they told you, we're going to give you a little bit of a medication to make you go a little bit sleepy.
To make sure Reg's ankle is still getting blood supply and to avoid infection, it's critical the team work quickly to sedate him and get his ankle back in place.
There's no guarantee we'll be able to get it perfect.
But his ankle is so broken and dislocated, Dr. Asier is worried it won't be straightforward.
There is a risk that we actually don't get the fracture in a good position or we don't reduce the dislocation. It can compromise the blood supply to the ankle and the foot. So this is a really time-critical procedure that we need to do. So that's just a risk, I'm afraid.
Do what you gotta do, man.
So I'm going to give 30 of propofol.
Dr. Asier is sedating 27-year-old Reg before they can pull his ankle back into place after he was hit by a car.
All right, mate. Think about something nice. What's your favorite place in the city?
Shady Lady, it's a bar.
Shady Lady? Okay, picture you sitting at the Shady Lady and you're on your 7th drink.
Oh, nice.
I'm trying to sedate Reg, and it's taking more medication than I anticipated. People's tolerance are different. What we don't want to do is knock someone out. We need to take over his breathing and his blood pressure. Do you want to give a painful stimulus and see how we go?
To test how sedated Reg is, Dr. Ali gently begins the procedure.
Oh, no,
Reg,
no, no,
Reg,
no, no,
Reg,
no, no,
Reg,
no, no,
Reg.
no, no, no.
Just stop, I'll give him some more
Bear
fentanyl.
with me.
How much longer have you got, Ali?
Get 40.
All right, so I've just given 40 of propofol.
Oh, good man.
Reg is finally asleep. Dr. Ali acts quickly to put his badly broken ankle bones back into position, clean the wound, and get the plaster on.
He's taking breaths, they're just a bit shallow. Oh. Reg, we're done, okay?
With Reg's ankle now in plaster, the team need to find out if they were successful in getting it into the right position, or if they will have to do it all over again.
Okay?
Reg, sucks.
Let's get you some pain relief. So the next thing to do for Reg is to do repeat x-rays. I'm really quite concerned that we may not have been successful.
While waiting for an x-ray to see if Reg will have to go through the painful procedure again, he realises his mistake.
That was completely my fault.
Yeah.
I was an idiot.
That's why we call them accidents.
Yeah, I was late for a date.
Did you let your date know that you...
I did, actually. It was actually the first thing I did when I hit the ground, but I looked at my phone and texted her and was like, I'm gonna make it.
That is one excuse.
Reg's date, Katya, was waiting in a restaurant for him to arrive.
Reg is just a lovely person. So this is the text he sent me. Sorry, comma, won't make it. Got hit by a car, LOL. I thought maybe he could be winding me up because he has that personality or is a bit cheeky.
Oh, here's the x-ray.
If the x-ray shows that Reg's ankle isn't in the right position, the team will need to do the whole procedure again.
Just gonna do a lateral. So... Not great.
It's still dislocated, isn't it?
It isn't good news.
Yeah, so, Ali, it's still dislocated.
Yeah, it doesn't look good.
And you've had an LOC for approximately 7 minutes.
Head down, Forrester. Head down, head down. Good job.
In Trauma Bay 2, Dr. Mark is trying to find out how badly mangled 36-year-old quarry worker Luke's arm is.
Hopefully he's got an elbow still and a little bit of forearm, because that'll give him more function in the long run than if he's got an above elbow amputation.
You're okay, Dale. Try not to move that, okay?
Experienced emergency nurse Tanya Wallace is used to helping patients like Luke with catastrophic injuries.
Lie down, Dale. Lie down. You're doing so well. Lie down. Good job. Thank you.
Luke's definitely in shock and overwhelmed. He's quite agitated, moving around a lot, unable to sit still. Luke was given a lot of ketamine in order to help his pain. It unfortunately does and can cause hallucinations. I think it's really important to have that connection and build that trust really, really quickly.
You're doing really well.
Shit happened.
I know, mate. I know.
And feel.
You can feel everything, yeah. It's horrible. We're gonna help you out. You just let us know if you start feeling any pain or anything, okay? Just stay really, really still for me.
Luke's older brother Joel has arrived in ED and is waiting outside.
When I got the call, it just makes your heart stop. To hear something like that about your younger brother just rips, mate. And because we are so close, everything I've wanted to achieve, he's been there, pat me on the back. Just, yeah, top bloke. Yeah.
An X-ray of Luke's arm will confirm if any part of it can be saved or if it will have to be amputated.
Just try and hold it still while we take some pictures of it. We'll take an X-ray of it.
One of the things with amputations of limbs that really affects how the long-term function is going to be is whether it's above or below the elbow joint. If you can keep your elbow joint and have a prosthesis attached below it, it's much more functional for the person and easier to learn to use than above the elbow.
X-ray.
My name's Mark, by the way. Okay, so we've got an elbow. That was the main thing to work out.
So it's good news that we can see an elbow and a little bit of below elbow bone. That's a really positive step. To know really, though, what's salvageable out of this arm, we really need to see what it's like under the bandages. At this point, I'm pretty sure that a lot of arm's going to be lost.
The team know that what they're about to see will be horrific.
We might take that dressing down if you want to take a squeeze.
Ali, it's still dislocated.
Yeah, it doesn't look good.
Community worker Reg is being treated for a severely smashed ankle after he was hit by a car while running to catch a tram.
Okay, I'll just take a picture.
An X-ray has shown Dr. Asia that they need to redo the procedure, and she must break the bad news to Reg.
Reg, we tried to put the ankle in a better position, but it's still dislocated. So we need to sedate you again to get it in a better position.
That's sure, man. I love that shit. It's awesome. Don't worry about it.
Reg is a great patient to look after, and he's very understanding of the fact that we are trying to look after him, and he's aware of the risks and benefits of the things that we are trying to do for him.
Worried about lack of blood flowing to the ankle and infection from an open wound, Dr. Asia calls orthopaedic Dr. Joed Haidar to help.
You're going to need an operation, to be completely honest with you.
Yeah, okay.
But first things first, let's get it stabilised, get the right scans, and then come back and talk about where to from there.
Reg has really injured and damaged the structures surrounding his ankle. It's just slipping out because the ligaments are damaged. It's like a bag full of bones. It's really urgent that we perform this reduction, particularly to stop damage in terms of the blood supply to the ankle and the foot. Everyone happy to start? Any concerns? So that's 50 in.
Once again, Dr. Asia needs to get Reg's sedation levels just right so Dr. Joed can get to work.
That's it.
That hurts.
I know.
I'm sorry about that. I'm gonna give 40 more.
Deep breaths, Reg.
Oh, don't do that, please.
Don't do that. Okay.
Deep breath, man.
Just giving 30 of propofol.
Deep breathing, Reg.
Starting to grimace.
The break is so bad that even Dr. Joed is finding it hard to get Reg's ankle back into place.
It'll reducing this position, but we're just going to have to immobilise it and chuck it on the position. What I'll get you to do is hold there. It's just very unstable. Yeah, it is.
Dr. Joed has struggled to get Reg's ankle into position.
He just kept slipping out the back. Really unstable. He could still be out with his heart's enough. The X-ray will tell us the story.
If the X-ray doesn't show the team has been successful, they may have to do the procedure for a third time.
That's good. Better.
That looks much better, yeah.
Finally, there's some positive news.
It's not dislocated anymore.
Fuck yeah, that's awesome. Thank you.
I'm really pleased for Reg that his ankle is in a better position this time round. He's got signs of really good blood flow towards his ankle. He'll definitely need an operation, and he'll need an extensive period of rehab.
You look after yourself?
Despite facing a huge operation to fix his ankle, Reg is still thinking about his date.
I'm sure I'll see you soon. I might be able to get some pity points out of this. I'm not too sure. Let's hope.
After a day when the ED has been non-stop with traumas, emergency doctor Jonathan Papson is experiencing an unusual moment of quiet.
I feel like I'm hunting for work.
But the search for another patient is soon over.
I've just put my name on a patient who's drilled a screw with an automatic drill into his thumb. So I was just going to have a look at his x-ray and see how severe that is.
The patient is 48-year-old Matthew.
Yeah, here we go. So this is Matthew's thumb, and that's the screw. Sometimes the x-ray can be tricky and it's not actually in the bone. I think it's right into the bone. It looks like it's probably about 1 centimetre in. I reckon that's going to be hard for me to pull out. Let's go and see him. He's around here somewhere. I look at the x-ray and it looks pretty well into the bone. But the way the x-rays are taken, it could be that the screw is in the flesh over the bone. If it's into the bone, there's more chance of infection. It'll be dirty, it'll be greasy. We'll just have to have a look and have a feel. Oh, yes, I see, yeah.
Father of two Matthew was building an outdoor awning at home when the accident happened.
So I've drilled a screw into my thumb.
Yeah, so you were you doing the...
Holding it up like that,
yes.
drilling in upright, and the screw...
So it just goes straight in?
Straight in.
Yeah.
Just like that.
Usually it's the last bolt or something, isn't it? Usually just about to finish.
Australia's love of DIY sees at least 9 people a day admitted to hospital, and 70% of power tool mishaps are to the hand.
If I had $1 for every DIY and injury, I would be a rich man. Yeah, that's a bit of a fright. That's what we do. It's our core business. Should there be a licence for DIY things? Maybe you should read the instructions. Maybe you should watch the video on how to do it. Have you got numbness in your thumb?
There's a little bit of tingling there.
Yeah.
I can feel you touch it.
Yes. Can you bend it? Yeah.
Matthew's livelihood relies on him being able to use his hands.
I teach baking, so I'm a trade teacher. It's a physical job, so, you know, my hands are very important to me.
So I've seen your x-ray. It looks like it's gone into the bone. Yeah.
Right.
So what I was going to do is going to pop a little nerve block in here to numb the whole thumb.
Yep.
And I might just touch it and see whether it falls out. Right?
Okay.
So one of the great things about hand injuries is you can pop a needle into the right spot and actually numb the nerve that supplies the finger or the thumb. It'd be like what the dentist does. So then I can do what I like to his thumb. It might just be hanging in there and I can just pull it out. Or it might be really stuck fast.
I definitely can't believe that you drove yourself in.
Matthew's daughter Cece rushed to be by her father's side once she heard about the accident.
And then I had the police behind me. I'm thinking, oh, I hope they pull me over, because then I can ask, can you get me to the hospital?
It is so typical of Dad to do everything himself and then not want us to worry about it. I love my dad a lot. If I'm ever in an accident or ever in trouble, it's Dad that I'm calling.
Dr. Jonathan's now ready to numb Matthew's thumb.
OK, ready? That might sting a bit. Wow. Is it OK?
Yeah.
We'll just give it a moment to work.
Now that Matthew won't feel any pain, Dr. Jonathan can give the screw a little wiggle to see if it's actually drilled into the bone.
Do you think it'll be deep?
I think it'll just be drilled into the bone. It'll be too tight.
We'll soon find out. I don't think I'll look.
Yeah, it's in the bone.
Thanks, mate. Cheers. Thanks, mate.
As Dr. Luke takes a quick break from the ED floor, emergency nurse Liz Wheeler offers him a little treat.
I reckon we're all
Sure? Can't entice you with a
I had
pink
lunch
one?
like 2 hours ago, so...
This will keep you going for another...
No, I'm good.
You're sure? All right, no worries.
Having resisted his sweet tooth, Dr. Luke heads back to the ED with his next patient on the way.
I'm happy to take it if you want.
Okay, cool.
So we've got a 32-year-old woman who is currently 30 weeks pregnant that is intubated after she was involved in a bike accident where she was knocked off by a bus. She was quite agitated, had a lot of vomiting, and so she's been intubated to protect her airway.
Hey, Luke, are you going to be in with the pregnant trauma?
Yeah.
As they wait for the patient to arrive,
Oh, there we go, 30 weeks gestation. Yeah.
Dr. Luke and the team quickly get up to speed.
Did you know when she's coming?
They landed us and we don't want to be too far away. When we manage someone who is pregnant, the stakes are much higher and obviously it's a more dangerous situation. I have a young child, I have another child on the way, and so these cases, I find them particularly difficult sometimes.
The patient is 32-year-old Natalie, a mum of two who was riding her bicycle to drop her daughter at daycare when they collided heavily with a bus. Fearing she and her unborn baby are at high risk, Natalie's been flown 260 kilometres to Melbourne, where an ambulance met the plane to rush her to the ED.
Might give ICU a heads up.
You're right, Natalie. You're at the Royal Melbourne Hospital.
Experienced ED nurse Kevin Newen knows it's vital to speak to Natalie, even though she's unconscious.
You're right, Natalie.
When I talk to patients that are unconscious, I try to tell them what's happening and try to reassure them they're in a good place, that they're going to be all right.
You're all right. Thanks, Natalie.
Natalie was out on a bicycle with her 2-year-old child and she thought that a bus was stopping and has knocked her at about 30 kilometres an hour.
Have you got a clear tap?
Yeah. The main thing that happened during transport was her waking up despite high level of sedation. She also had a formal ultrasound, showed sluggish fetal movement.
A sluggish fetal movement in this situation could potentially indicate some harm to the baby, but is also representative of the fact that she's been sedated. So it's important that we investigate that.
And in terms of what happened to her 2-year-old child, I believe discharged from ED with no injuries into the care of Natalie's husband, the patient's father.
Natalie's husband, Tim, is now making the 4-hour journey from country Victoria to be by her side.
Are we on our sedation now already, Babs? Or?
Yeah, our sedations have started.
Keep it at 200 and 200. Sounds good, yeah.
The team make sure Natalie stays completely sedated so Dr. Luke can see if her baby is moving.
You happy from the vent point of view, Kev?
Yeah, happy.
I saw some facial grimacing.
In pregnancy, mothers require quite a lot of sedation to keep them asleep whilst on the breathing tube. It's always a balance when trying to adequately sedate someone but not over-sedate someone. If we over-sedate someone, it has negative effects on their blood pressure, and so it's challenging, particularly in pregnant patients.
She's alight. Can you grab this Aramine for us?
Yeah. We'll give 0.5 Aramine. Yeah, cheers.
Natalie is waking up.
Bit of frost line there. So Natalie is light with her sedation, meaning that she is not as asleep as we would like her to be. And that puts her at risk of biting on her breathing tube, pulling out the breathing tube, or moving or putting her otherwise at risk. All right, let's have a look at Bob. You all right? As I prepare to do the ultrasound, what I'm looking for is a vigorous baby with an appropriate heart rate. And my worst fear is not seeing any heart rate at all. So if I find that the baby is in significant distress, and the next step might be actually delivering this baby early, I really want to know that this baby's okay.
I think it'll just be drilled into the bone. It'll be too tight.
48-year-old teacher Matthew has a screw stuck in his thumb after he slipped using a power drill while building an awning.
I don't think I'll look at it.
Dr. Jonathan was hoping to be able to remove it with a little pull, but it's firmly in the bone.
I think I could take it out, but it's in the bone. So I'll have a chat to the plastics guys. Hi, it's Jonathan in emergency. I've got a guy who's drilled a 3-centimetre long screw into his thumb. What do you suggest we do? Do you want to pull it out in theatre? Or alternatively, I could twist it out. I reckon I could do it because it's not too sore. So I've got good news and bad news. Good news is the plastic surgeons want to wash out the thing. The bad news is they don't know when they can do it, so they said, why don't I try and pull it out? I reckon I can get it out for you. And then they can wash it later. Are you OK with that? Yeah. I'll just try and screw it out, just the way it came in. A lot of medicine is actually just common sense. I don't remember ever being taught how to do this one. So like any screw that's stuck in the wrong place, you should be able to just unscrew it. All right, ready?
I'm ready when you are.
Dr. Jonathan gently begins to turn the screw anti-clockwise.
OK?
Yeah, keep going.
It's coming easy. You're amazing, look at that. Out she comes. There we go.
You're out.
I'm out.
That's it. Job done.
Oh, yeah, look at that.
Exhibit A. This has made my day. The actual thread didn't feel like it was in the bone too much. So good choice of nail. Maybe not so good to put into your thumb, but...
No, but anyway, it's done.
I think I was a little bit more squeamish than expected, just creeped out by it.
So let's give it a good wash. You all right?
To avoid infection, Dr. Jonathan cleans the wound.
That's beautiful. Anyway, the plastic surgeon will come and see you. The nurse will pop a drip in and we'll give you some antibiotics because you need some antibiotics.
Yep.
Don't eat or drink anything.
It didn't really feel too much, just the first initial twist. I could probably feel the skin come loose, and I'm relieved that it's out.
We're going to admit Matthew to the ward and he's going to see the plastic surgeons and they'll use their special instruments to clean it and wash it. What's my advice for DIYers? It's always the last bolt of the day that messes you up. Maybe before you get to the last one, just have a little break, a little pause before you finish. That's my advice.
Once I'm all healed, I'll finish the job off.
Might take that dressing down if you want. We'll take a squeeze.
Young father of one, Luke, is facing an amputation of his arm after it was dragged into a rock-crushing machine.
Hey, Luke, my name's Abby. I'm one of the other nurses.
An X-ray of Luke's arm has given Dr. Mark vital information.
I'm just going to hang out. Is that okay?
No. Yeah, chill.
Finding he's got an elbow there is a piece of good news for Luke. So as we take all this bandage off, the main thing we'll be concerned about is uncontrolled bleeding. We'll be watching carefully to make sure that the tourniquet is adequate.
Hello, you're from Plastics.
Yeah.
So he's actually got a stump around elbow level.
Before they start to unwrap the bandages, it's essential that Dr. Mark has the specialist team standing by.
It's important now for the teams that are going to be operating on this limb to look at what they're dealing with.
Tourniquet time's about 2 hours at the moment. So once we get more assessment done, we might loosen that off and see how he performs.
With everything in place, Dr. Mark and the team can now begin to delicately unwrap the bandages to see what's left of Luke's arm.
You want to get a dressings pack out?
Yeah.
This is going to be our first look, yeah.
Doing good. Keep relaxing.
All right.
Oh, just want to see.
You want to see?
I don't think you want to look at this too much.
Luke's really curious to look at his arm. I'm very concerned about him seeing things that are going to create long-term distressing memories that he doesn't need to have.
You comfortable?
Emergency nurse Abby immediately improvises a screen and stays beside Luke to comfort him through the procedure.
Where's the blue thing?
No, the blue thing is just for your own safety.
Oh, the poor person.
The injury is even worse than anticipated.
Come on, let me watch.
Oh, you don't want to look at this, mate.
It's one of the more grotesque injuries that I've seen. It's mangled all the way along. One of the things about doing this kind of work, you need to be able to just look at the clinical problem and kind of sit that alongside the human that you're being compassionate and caring for.
You're right to give it irrigation and dressing?
This is certainly one of the worst limb injuries that I've seen.
Can you put your head down? Relax.
Limestone quarry worker Luke needs to have his lower arm amputated after it was crushed by an industrial grinder.
Just relax your head down. You're doing really good.
Dr. Mark and the specialist surgeons who will perform the amputation are now seeing the extent of the wound for the first time.
Are you okay? Yeah?
The plastic surgeons are looking at this wound with an eye to what's viable, so what's alive and what's salvageable. Hands that go into machines are often contaminated with dirt, grease. Infection is catastrophic. So it's really important that we get on top of that early.
I want to see.
No, just put your head down.
I think the tourniquet's going to need to stay on. I don't think it's going to do too well without.
Dr. Mark is worried about Luke losing too much blood.
Luke, I'll put another cannula in your left arm.
The ambos have put on a tourniquet. That's a life-saving thing. It does mean that those parts of the wound that we want to save are not getting any blood supply at the moment. So there is a time pressure because all that time the blood's not flowing into those tissues means those tissues are slowly dying.
What are you doing? Almost done, mate.
Now that Luke's wound is clean, the team quickly apply a new dressing to prevent infection before he's taken to surgery.
Look, my name's Jane. I'm from the plastic surgery team.
With Luke now ready for surgery, the specialist surgeons ask the one question that will have the biggest impact on Luke's future.
Are you left or right-handed? What hand are you usually like with? Left. Your left hand. Okay.
Luke turns out to be left-handed, which is a real blessing in this case. Another small win for Luke.
He's got an elbow joint and some radius and ulna that's viable looking.
But the team still don't know if all of Luke's arm needs to be amputated or if they can save part of it.
They're going to do my surgery for you, okay?
As Luke waits for his operation, Nurse Tanya tries to comfort him.
You need 2 legs, 2 hands.
You'll be okay, mate. You'd be surprised what they could do for people now, okay? What's wrong?
As Luke heads to surgery, it's still unclear how much of his arm can be saved.
What happens from here for Luke is several operations to get the most out of what's left. And that might mean pinning some bone fragments to help them heal. It's a life-changing injury for Luke. It's a long healing process physically. It'll be a long healing process mentally, and it's going to require rebuilding a way of living and a way of thinking about himself.
She's alive.
Dr. Luke is treating 32-year-old expectant mum Natalie, who is on a ventilator after an accident where the bicycle she was riding collided with a bus.
We'll give 0.5 Aramine.
The team need to make sure the sedation doesn't make her blood pressure drop, while Dr. Luke checks to see if Natalie's unborn child is moving.
You just cycle that BP for me as well.
Yep. 88 on 42.
Yeah, some Aramine going in. This stage of 30 weeks, third trimester, we need a lot of sedation. So it's enough to keep her asleep, but also enough to tank the blood pressure.
Yeah, okay.
So we just got to find the right line.
Emergency nurse Babina Shah is in charge of monitoring Natalie's blood pressure. If it drops rapidly, she and her unborn baby are in danger.
Look, whenever you're ready, we can just change
Switch
the
on.
outline.
If Natalie's blood pressure drops, then not only is she not getting enough blood to her brain, but there's compromised blood flow to the baby, and that puts baby at risk.
With Natalie now fully asleep, Dr. Luke quickly proceeds to check the baby's movement.
All right, let's see where the baby. Good fetal heart. Not a whole lot of fetal movement.
Natalie's baby isn't moving.
Ev, can we pop her on the CTG after this as well?
Yeah, definitely.
Normally, when we look at a healthy baby with ultrasound, we see vigorous movement of the arms and legs and the head of the baby. In this case, I can see a normal fetal heart rate, but I can see a baby that's really not moving a whole lot. And given that the baby has sluggish fetal movements, I asked Babs to put on the CTG monitor. The CTG monitor monitors the heart rate of the baby, but also whether or not the fetus might be in distress.
As Nurse Babina begins to position the heart monitor, Dr. Luke, hoping to find some movement, quickly tries a different angle with the ultrasound.
Can I have one quick look at the quadrant
Yeah,
first?
you
Sorry,
do
I'll
that.
2
You do
seconds.
that.
Maybe lift left arm up.
Sorry, Natalie. Just gonna need to monitor the bub, so we're just gonna put in some tubes through here, love.
Again, Dr. Luke can't find any movement. Extremely worried, he urgently wants the specialists to see if Natalie's baby is in distress.
They're going to come over now, did they say? Or?
Yeah.
Jeez, I'm just having a look. There's not a whole lot of fetal movement. The sluggish movements make me think that there's something going on. So I'm very keen to get the obstetrics team to come and have a look. Izzy, they're going to come over now, did they say? Or?
Yeah.
Dr. Luke is waiting for obstetricians to examine 30-week pregnant Natalie, who's been put on a breathing tube after an accident while out riding her bicycle.
We saw the bump in there?
Yeah. Not a whole lot of fetal movement. Good fetal heart. Obs are on the way over.
The life of Natalie's baby could be at risk, as a little movement was picked up on the ultrasound.
Hey. How you doing? I'm Luke. I'm one of the ED docs.
Hi, Luke.
If it gets to the point where we need to do an emergency cesarean, it's really reassuring to me that I have the obstetric team on standby to be able to do that.
They're just checking on the CTG. I've just done a quick scan. I can see fetal heart like 140, 150. Not a whole lot of fetal movement though.
Oh, okay.
If you want to use your ultrasound, feel free.
Specialist obstetricians Dr. Nicole Chisholm and Dr. Cassia Mikulak immediately examine Natalie to see if her baby is moving.
Natalie, just some more doctors come to check your baby. We're going to hospital next door. We're just going to feel your tummy and we're going to check sure you're not bleeding or anything.
It's an anxious wait for Dr. Luke and the team, hoping Natalie's baby will be okay.
All finished now.
Finally, the specialists have positive news.
All good. Tummy feels nice and soft. Baby's alive. I mean, we don't think she's in labour. Not bleeding. She's not membranes.
It's definitely a really big relief to know that both mum and baby seem to be doing well. It's reassuring to me that the reduced fetal movements are probably just from the sedation medication that's affecting Natalie and also baby. Essentially, baby's asleep for the same reason that mum is.
Cool. I just spoke to ICU. They're going to try and come and collect her as soon as they can.
Great. Beautiful.
Now they know Natalie's baby is okay, the team prepare her for ICU.
Next steps in Natalie's care are to slowly wake her up in the controlled environment of the intensive care unit, away from the chaos of ED.
Hey, Natalie, we're just going to put something more comfortable around your face, yeah?
Finally, Natalie's husband, Tim, arrives.
And the kid, where are the kids? Okay, all right. You can come over, say hello, hold her hand if you like.
Yeah, she's just starting to like open her eyes a little bit.
She?
Yeah. Sorry.
With Natalie now stable, she can leave the ED and head to ICU.
Hopefully we can get the tube out. They'll just do it upstairs, a bit more of a controlled environment, rather than down here, which is a bit more chaotic, okay?
Until Natalie is awake and off the breathing machine, we won't know the extent of the potential damage that's been done to her brain. So she's at least had a really serious head knock and a concussion. She may have ongoing problems laying down memory and with some other functions of her brain as well.
32-year-old community worker Reg badly broke and dislocated his ankle when he was hit by a car as he was rushing to meet his date.
His right ankle, as you can see, is severely deformed.
There's no guarantee we'll be able to get it perfect.
After 2 attempts, the team were finally able to get his ankle back into position and plastered before he was sent for surgery. Reg spent a week at the Royal Melbourne, where more injuries were discovered.
I had a small little fracture in my wrist, I had a small fracture in my T5 vertebrae, and then I actually had 5 fractured ribs on my right-hand side.
Reg has undergone intensive rehab and multiple operations for his ankle.
So I had a big piece of scaffolding on my leg that straightened it up, and then after that they put 5 plates and about 16 screws.
As for Reg and his date Katya, their romance continues.
So you know those paintings that we did
Yeah.
the other week? I think we should do it again. I think it'd be fun.
Yeah, I want to redo mine anyway, because it looks not very good. Everything's going well between us.
You know, it's very special.
So you don't have rehab tomorrow?
No, not tomorrow. Next Monday.
48-year-old DIY enthusiast Matthew arrived in emergency after drilling a screw into his thumb while building an outdoor awning.
Usually it's the last bolt or something, isn't it?
Dr. Jonathan gave Matthew a nerve block before successfully removing the screw and dressing the wound, ready for the plastic surgeons to take a look.
Job done. Exhibit A.
Matthew was able to go home later that day and has now finished building his awning without any further mishaps. 32-year-old pregnant Natalie was transferred to the Royal Melbourne on a ventilator after she was knocked off her bicycle by a bus.
You're right, Natalie.
Dr. Luke feared Natalie's baby was at risk.
Not a whole lot of fetal movement.
A few days later, Natalie still can't remember much about the crash.
When I woke up, I don't think I knew where I was or what I was or anything that was going on. I lost a lot of the day not having a clue what had happened.
With Natalie's unborn baby given the all clear, she only has one thing on her mind.
I just want to go home at the moment, go home and see my kids. I've been dreaming about it all day.
As for getting back on the bike, that's unlikely to be happening anytime soon.
I assume my husband won't let me back on a bike until well and truly after the next baby's born.
She can do what she likes, but I would strongly suggest that she doesn't.
Yeah.
36-year-old limestone quarry worker Luke was choppered into the ED after his right arm was caught in a rock crushing machine.
Don't hurt.
It's an amputation.
X-rays revealed to Dr. Mark that Luke's elbow was intact and could be amputated below the joint.
If you can keep your elbow joint, it's much more functional.
And there was another piece of good news for Luke.
Are you left or right-handed?
Left.
Yeah, so that's what it sort of looks like now.
10 days after the accident, Luke's still in hospital and has undergone several operations on his arm.
So I had to go in to surgery 3 or 4 times and get it scrubbed out because the gear on the machine was full of grease. Yeah, now they've done the big skin graft and popped it over there and it seems heaps better now.
But the healing process will take some time.
They say a good year and a half before I'll get into the prosthetic side of it.
Throughout it all, Luke's brother Joel will be by his side.
We'll make something to go on the end of it.
Yeah, that's it. New contraptions. For something like this to happen, for him to be sitting there in such a positive mindset is just pretty good.
He's always been there for me, so if something happens, he's straight there or on the phone or... Right, we'll be right. We'll get through it, mate.